Hi, this is Dr. Steffensmeier, Des Moines Eye Surgeons. I wanted to talk to you today a little bit about some of the things you can expect in this first couple of days after you've had your cataract surgery. First thing, what we did was made an incision on the front of your eye in order to get the cataract out. And the feeling of an incision is a scratchy feeling like you've got a piece of something in your eye. It oftentimes gets watery as well, and that can last most of that first day after surgery. It's usually quite a bit better by the following day. Another thing you'll notice is fluctuating vision. Part of that is because after the surgery, swelling starts to develop in the cornea, and so things can get hazy or foggy or cloudy, just like moisture and air has that effect of looking hazy. So it's normal to get worse as the day goes, that first day, and sometimes that can linger for a few days. As you're healing, you also might notice some days it does a little better than others, but generally you should be getting better. After surgery, it's also kind of normal to sometimes see a little bit of a shadow off on the sides or a little bit of flickering to your vision. Those will usually go away within days to weeks sort of timing. A few of the other things you can expect. Sometimes they give you medicine in your eye at the end of the surgery, which good news is it might mean you not need to use medicine drops after the surgery, but you might notice some effects from the medicine itself in your eye these first few days as well. You can see some redness down at the lower part where I put an injection of medicine in your eye. You might see the medicine itself. It's kind of a little white glob that sits down there. And as time goes, it settles down and eventually will dissolve away. Other things you can do to kind of help with getting through these next couple of days, you can use some artificial teardrops that help soothe that irritation feeling. You're welcome to put them in the fridge. Sometimes a cool drop will feel a little bit better. I want you to be careful that you're not putting any pressure on your eye, which also includes when you take the teardrop, make sure you just have finger pressure out over the bones of the eye socket, no pressure on the eye itself. We'll give you a shield. I want you to put that on when you sleep with tape kind of going from the middle of the forehead to middle of cheek. Also, for the discomfort, you're more than welcome to use some ibuprofen or Tylenol. Just follow the directions on the bottle for the dosing for that. All of those help take the edge off, and then just some time to let it settle back down. If you chose to have vision corrected for distance vision without having to put on glasses, it means you probably will now need glasses to see anything up close. That's usually about anything from arm's length in closer. The way reading glasses work, the higher the power of the reader, the closer the focal point. Most people are comfortable reading with around a +2 to 2.5, 250. Somewhere in that range usually gets you through pretty well until you can have actual prescription made, which will be a few weeks from now. All right, I wanted to tell you about putting in eye drops and putting your shield on after your surgery. Remember, we don't want any pressure from your fingers inside the eye socket. So that means when you're putting fingers around your eye, the bones around the eye are where the safe part is. And the easiest way to do that is have somebody look up and with one finger down below, again over the bone part, just pull the lid open a little bit and you can drop the drop right into the well, which you kind of make between the eyeball and the eyelid. That's a comfortable place to have a drop and it's perfectly safe to do. When we're putting on the shield, it doesn't really matter whether it goes on this way or this way. The rules are the same. We want the edges out over the bone part of the eye socket to help absorb any pressure that might be applied and keep your eye safe. And the tape goes on best if we go from the middle of the forehead to the middle of the cheek. The goal here is to keep it on through the whole night, which means you need it secure enough to be stable. Most people are more comfortable with this little pointy part towards their ear, like so, and then just go middle of forehead to middle of cheek with the tape. If you need another piece, you can put one on the sides instead of the middle if you want to be able to see around it. That's it.